Any good healthcare conversation starts before you get to an appointment, and advocating for yourself always means having some kind of game plan. So I want you to think about how you prepare usually for your appointments. Now, when we did our focus groups, they came up with a number of things that you can do to prepare for your appointment. And the first one there, Black Binder to a Red Purse, is really about where are you going to put information? How are you going to keep everything organized from all of your appointments? And it's really important that you choose a strategy so that when you're preparing for each of your appointments, you can look over past notes, reports, and really figure out what am I going to talk about here. And the Red Purse was a lovely story of an older adult who had some very complex chronic conditions. And she said, they were rather depressing to her to have to look up before the appointments. So she chose a red purse because that made her smile. That made her think, well, isn't this beautiful? And it's important that when you're picking a strategy for organizing your materials, you're also picking strategies, not just at that point, but throughout your journey that give you moments of repose, of respite, that make you smile, that help you get through what can often be a very challenging experience. Keep an updated health history timeline. So there are wonderful tools available that you can use to do this, or you can write out your own. But I would suggest you put together a timeline that goes childhood, early adulthood, middle ages, and then when you get to the 50s, break it down by decades. When you go into an appointment, on average, it's 8 to 15 minutes long. You don't have a lot of time to recall information or to look things up. If you have your health history timeline and the doctor or the nurse asks you a question, you can pull it out and go, yeah, that happened when I was 56 years old. I had that surgery. There were no complications, etc. Bring yourself to each appointment. What this means is really take the time to review your notes ahead. Again, so you're not taking time up in the appointment to recall or to understand what happened previously. Remember, set those priorities. 1 or 2 is your maximum for each individual appointment. If you go in with a long laundry list of priorities, unfortunately, you're not going to get any one of them a good, fulsome answer. You're going to waste your time amongst them all. So when you tell your story, if things interrelate, that can go into your story. But when you ask, you make your ask, choose 1 or 2 to focus on, the most important for that appointment. List and pack up all your medications. And a good tip is there are a lot of pharmacies out there who will actually print a list of your medications and your past medications for you. So you can just bring that with you. And if there are any questions, you have it there. And then find out what's expected of you. Do you have to do anything before you're going to this appointment? Anything around eating, anything around drinking? Do you need to fill out any forms? What's the parking situation? Ask those kinds of questions and get that information before you go to the appointment. Starting at home is also really about including those support people. Include them if they can come to the appointment, but include them before as well. Talk through what it is you want to get out of the appointment, and having that other perspective will help you think of questions, will help you think of priorities you might not have thought of. Those people, if you're setting them up to come with you, can be helpful in listening. They can be helpful in note-taking. Of course, language interpretation or cultural interpretation if you need that, physical assistance, and don't diminish the need for emotional support. Big things happen in medical appointments, and it's very important and very difficult to hear what a provider is telling you if they've just given you some kind of intense, complex diagnosis. So having someone to speak through the appointment ahead of time and during and after is a great thing.